Inside the stories that affect you. This is Inside KELOLAND.
I'm Perry Groten. Thanks for joining us. The COVID-19 arrived in KELOLAND on Tuesday. Now, just days later, the number of cases is rising, and so are the precautions. The city of Sioux Falls was the first to declare a state of emergency. On Friday, the state did the same thing.
We are asking schools to close next week statewide. I'm recommending that states and that the schools use this time to clean their facilities and to prepare for the following week.
Well, from protecting yourself from the illness to what you should do if you are sick. Tonight we're going to walk through everything you need to know about the coronavirus. Joining us now is Dr. Wendell Hoffman, who specializes in infectious diseases. Thanks for joining us, Dr. Hoffman.
Thank you for having me.
Well, we just heard Governor Noem requesting schools to close for the time being, starting this week, and clean their facilities. What kind of an impact will that do if it's done statewide?
Well, we're hoping that it'll have a very positive impact, but we're not exactly sure. This virus has more or less spared the younger age groups, as opposed to the H1N1, which targeted children, young adults, and pregnant women. But I think it's very prudent to take this step, and even though it's going to create some chaos for a lot of families, just because when we have all these children out of their normal context, it will definitely raise challenges for any parent, particularly parents even in the healthcare system. We know from the H1N1 influenza pandemic in 2009 that school closures did result in decreasing numbers of cases. So we're very hopeful that this, along with a lot of the other social distancing measures taken both here in South Dakota and across the country, will definitely begin to tamp down on these cases that are occurring.
Mm-hmm. Let's go right back to the basics now. What exactly is coronavirus?
So coronavirus is a family of viruses. We've known about these viruses for years. We actually can measure 4 of them on a special test where we will put a swab up into the nasopharyngeal area, and we can test for multiple different viruses, and we already measure 4 of them. We think that this will be probably number 5, and because we anticipate that this will continue to circulate for years to come, which is part of the long-term sobering aspect of this. But the coronaviruses largely are viruses that cause the common cold. This particular virus is, of course, can cause cold-like symptoms. But in certain patient groups, particularly elderly, and those who have chronic medical conditions like diabetes, chronic heart disease, chronic lung disease, they are at a higher risk, as we're seeing from the China outbreak. And the potential mortality in those subgroups is higher than the overall in the overall stated mortality rate, which is probably somewhere between 1 to 2%. It may actually turn out to be less than 1%. So we really even don't know that overall, but we do know that the mortality in these higher at-risk groups is significant, which is why we need to take measures to try to distance those risk groups from people who might be carrying the virus.
And COVID-19 is the name of the disease you get from coronavirus, right?
COVID-19, yes. So it's CO is corona, viral, VI is a virus, and D is the disease. So that's the mnemonic. And then 19 is because it emerged in 2019.
Yeah. Where did it start from?
So it started in China, in Wuhan City, and most likely out of an open-air marketplace that deals with various different kinds of animals and birds. And so we have pretty strong evidence that that's where it emerged from, and then began to rapidly spread in Wuhan City and then to the rest of China within about a month.
Mm-hmm. What kind of symptoms can people watch out for with the coronavirus?
So great question. The official definition of COVID-19, the case definition, is fever, shortness of breath, and cough. Now, in the Chinese data, about 80 to 85% of the population was considered to have mild mild disease. Now, that may range all the way from being completely asymptomatic, and we know, again, from a large study in China that about 1% of that particular population was completely asymptomatic. But the symptoms that we've been seeing are, again, mild respiratory symptoms, much as we would expect from any typical URI.
Yeah, that's just, I mean, the symptoms are quite similar to the flu bug, right?
Well, they are, because so if someone would have, let's say, the symptoms of a cold plus fever, most of the time the common cold, we don't see much fever. Mm-hmm. But if someone were to have fever plus more of the typical signs of a so-called cold, runny nose and congestion, maybe some mild cough, that might be a little bit more concerning.
All right, thank you, Dr. Hoffman. We're going to be taking a quick break right now. We'll be back with Dr. Hoffman, and we'll get some answers to the top questions you're asking about coronavirus coming up next. Welcome back. We are back with infectious disease Dr. Wendell Hoffman. Now, there are a lot of things people want to know about the coronavirus. We've touched on some of those topics in our earlier segment, but let's take a look at some of the top questions you've been asking. Now, first of all, this question comes in, am I at a higher risk for COVID-19? Who is at risk for COVID-19, Dr. Hoffman?
So it appears there's two general categories. First of all, age matters. Mm-hmm. Really above age 60. You see a certain reported mortality rate in China between 60 and 69, then 70 to 79, and then 80 to 89, where the mortality in above 80 is probably somewhere around 15%. In the 70 to 79 category, it's probably about 7%. In the 60 to 69 category, it's around 4%. And then below 60, the mortality drops off significantly.
Yeah, why is that? The children are not as badly affected.
It's one of the mysteries that we are still exploring as to why children seem to be relatively resistant to the more severe manifestations, like as opposed to what they experienced in H1N1. So it is rather mysterious. And also the other question is, are children vectors then spreading this virus within our communities, as children typically are in the influenza seasons? So those are still kind of outstanding questions, but the larger point being that it is the chronic medical conditions, probably involving either the older or the younger, that makes us concerned. So people who, for instance, adults, particularly elderly adults who have chronic lung disease, chronic heart disease, and diabetes in particular have been the three that have been identified, are the ones that we need to try to protect.
Okay, let's go to our next question. Should I be panicked? That's a pretty good question. I mean, a lot of people, it's in the news a lot. We're reminded about the dangers. How do you approach that? What should your attitude be toward the coronavirus?
Right. So I think we need to approach this as a serious situation, rather unprecedented. And so whenever we have serious and unprecedented threats to the population, it's natural for people to sort of become panicky and become spooked in their reactions. And so we see lots of different behaviors. You know, the store shelves are emptying out of a number of things. But I think that the public should be reassured that we're doing absolutely everything we can, as we are also learning about this somewhat on the fly, because this just has gone worldwide in a little over 3 months. So there's lots to learn, and suddenly, as of this week almost, you know, it seems like it is upon us with the cases being reported in South Dakota. But there are many things that we can do. You know, the social distancing thing really makes a lot of sense. It's been proven in prior pandemics. The washing of the hands, we've known for 170 years that washing hands, you know, diminishes the likelihood that I'm going to pass an organism to you. And we know even from the H1N1 pandemic that hand hygiene reduced influenza infections significantly. So hand hygiene, social distancing, and then the last thing, what they call a non-pharmaceutical intervention, would be environmental cleaning, which is something that's very interesting and has been hot on the news media, the social media, is what does this organism do in the environment? We have some limited information that it does significantly contaminate the environment around somebody who is infected, but whether or not that's a major contributor to infection still has to be worked out. But it does make sense that if COVID is on a hard surface and I touch that hard surface and I go to my nose and mouth, it's conceivable, very conceivable, that's the way in which I will get it, as opposed to the respiratory droplets, which is probably the major mechanism, which are those small secretions that we all release, even with regular talking. So you don't need to sneeze or cough. Yeah. Just with talking, we project these out about 3 to 6 feet around us. That's probably the major mechanism, and also the environmental component.
We got another question. I have a cough or fever. What should I do?
So if you have a cough or fever, I mean, probably the first thing is not to get in your car and run into the emergency room or the acute care or urgent care, but is to call your physician. Particularly, I would say if you have a fever, which we try to define, the definition of fever in the medical literature is 100.4 degrees when taken with a good digital thermometer underneath the tongue. So if you do have fever, then it would also depend, do I also have significant respiratory complaints? Because if you're having cough and shortness of breath that is getting worse, we want to make sure that we see you, because that would be indicative that maybe what's happening is what is called a viral pneumonia. And so the thing that is causing death in patients is a direct pneumonia caused by this virus, typically in both lungs, and that can lead to decrease in oxygenation and cause a cascade of things that can lead to the demise of the person.
And when should people get tested then? That's
a believe it or not, that's a vexing question. We would love to be able to test everybody. There have been some glitches in the testing rollout. I think those are rapidly being fixed, and I think soon many healthcare systems will be able to have in-house testing that is ordered by their physician, and we'll be able to test many more. I would say right now we're trying to focus on those who are potentially more severely ill, although we would love to know, how many people in a particular population are positive. That may not be a luxury we have early on, but I think that will change as the testing rolls out and as more companies get involved in the development of these tests, and as healthcare systems then have them available to their doctors.
All right. Well, thank you so much for joining us, Dr. Hoffman.
Thank you for having me.
And so older adults are some of the most vulnerable when it comes to the coronavirus. Next on Inside KELOLAND, we find out how local assisted living and care centers are taking steps to keep the virus out. Well, now that coronavirus is here in KELOLAND, a lot of people and businesses are taking extra precautions, and that includes nursing homes and assisted living centers. Randy Burry, the president of the Good Samaritan Society, joins us now in the studio. Thanks for joining us, Randy.
Well, thanks for having me.
Now, you've taken steps recently to protect residents of the Good Samaritan Society from the coronavirus. What steps have you taken?
Yes, we have. We've taken a number of steps for the last, I don't know, approximately a month or more. We've been doing things like beefing up our infection control policies and practices, making sure we're doing everything possible to practice good infection control measures. But then, of course, as the cases have started to increase in the U.S., earlier this week we put in a restriction on visitors in our skilled nursing, what most people think of as a traditional nursing home. So basically right now, I mean, banning visitors sounds like, an extreme measure or something pretty onerous, and it is, and we don't take that lightly. But, we are responsible for the safety of our residents. And when you look around the country, around the globe really, and you see the impact that this virus can have on an elder population, I mean, it's a deadly virus to that group of individuals. And so the safety is more important than anything. And so we truly today are trying to restrict all visitors from coming in and out of any of those facilities.
Well, how can loved ones then keep in contact with their family members in a nursing home?
It's not always ideal, obviously, but the most basic, the telephone. FaceTiming, iPad communication, those kind of things we're encouraging. There's not an easy way to do that. And there certainly isn't a way that if you're a family member that's real satisfying to you. I mean, you want to get in there and see your loved one. And again, what we just keep emphasizing is that, people can unknowingly enter a facility carrying the virus. Nobody's malicious in this, but they could do it very innocently. And when you think about it that way, that by coming to visit your parent or your relative, you could bring a virus into a long-term care facility that it could ultimately result in the death of quite a few individuals within that building. I think you just have to think of it that way.
Yeah, we saw that be the case in Washington State.
Exactly.
Yeah. Talk about as far as any cases of coronavirus showing up in any of your facilities?
I think it's a knock on wood kind of scenario right now. We do not have any active cases that we know of in any of our facilities. Again, if you look around the globe, I'm afraid it might just be a matter of time. It's a when, not an if scenario. But that's why we're doing things like the visitor restrictions and emphasizing hand washing and social distancing, all those things. I think what you're seeing now nationally with, canceling March Madness and prolonging or suspending the NBA, those kind of things, that actually helps us all, I think, because the goal there with all of that is to slow down the spread.
And you recently met with Vice President Pence to discuss coronavirus. How did
I did. That was quite a career surprise. I got a call a week ago Wednesday, late in the day, asking if I could be at the White House the next morning. And, at first, you think, is this a prank? Or, but it wasn't. And so the next morning at 10 o'clock Eastern time, I was in the Roosevelt Room of the West Wing of the White House. There were 5 of us from industry. There were four of us from representing large companies, and then the Chief Medical Officer for ACA, which is kind of our trade association or organization. So we met with Vice President Pence, with Seema Verma, who's the administrator of Medicare Medicaid, and then Dr. Dorothy Birx, who's the White House coordinator of coronavirus. They spent about the first 25 minutes talking kind of a government update. Here's what's going on, which of course now 8 days later or whatever is largely outdated. That's how fast it's moving. And then they asked for our input. What things were we worried about? It gave us an opportunity to lift up some really important topics. Supply chain, the adequate supply of infection control equipment, gowns, masks, those kind of things. I still believe in a large part it's going to be a location shortage, not a national shortage. There will be supplies somewhere. They just won't be where we need them. If there's an outbreak in a given community, they'll start going through supplies quickly. We may need the federal government to step in and kind of commandeer some supplies and send to the area of need. The other thing we were able to talk about, and I was able to speak to this specifically, is medical professionals moving across state lines. We ran into this last fall with Hurricane Dorian. For a long time, it looked like a Category 5 hurricane was going to directly hit 3 of our facilities in Florida. We had volunteers across Sanford Health volunteering and saying, listen, I'll go down and help staff. I'll go down in the aftermath of this. Initially, the response from Florida was that we couldn't do that. Because the nurses were not licensed in Florida. Florida said they needed to do background checks and fingerprinting. It slowed the whole thing down. We were going to get through that and work through that, but my point to the Vice President was, don't make us waste time on an issue like that. Seema Verma at that point committed and said, listen, we can do that through an emergency waiver, where if we would run into that situation, which I think we probably will, the federal government would step in.
Okay. Well, thank you for joining us for Inside KELOLAND and sharing your story with us.
Thank you.
And in the wake of the coronavirus, the local blood bank needs some help, and some local technology is playing a key role in the nation's response. We'll take you behind the scenes when we come back. Stay with us. Well, if you are feeling healthy and are looking for a way to help, you might want to consider donating blood. With the threat of the coronavirus, 4 groups in the Sioux Falls area have canceled blood drives in a matter of days. That means the community blood bank needs donations. If you'd like to help out, you can donate blood at both the Vera and Sanford hospitals. If you have a business that would like to help, you can find contact I'm sorry. Okay. Okay. We're going to do that whole intro again? Or wait? Okay. Okay. Well, if you're feeling healthy and are looking for a way to help, you might want to consider donating blood. With the threat of the coronavirus, 4 groups in the Sioux Falls area have canceled blood drives in a matter of days. That means the community blood bank needs donations. If you'd like to help out, you can donate blood at both the Vera and Sanford hospitals. If you have a business that would like to help out, you can find contact information under this story on KELOLAND.com. Well, services offered right here in KELOLAND could help stop the spread across the country. Telehealth can play a big role in battling coronavirus. KELOLAND's Kelly Volk shows us what assisting a patient over video looks like.
It is helping some, yes.
Here, a Vera eCare Chief Medical Officer, Dr. Brian Scow, is seeing a pretend patient over video.
His blood pressure now is 90/57.
In this mock scenario, the high-risk patient is showing symptoms of the coronavirus.
In his case, we were able to isolate him. We only had 1 to 2 people come into the room, so the entire staff was not exposed, and able to get him transferred quickly to an intensive care room.
Scow says holding mock scenarios is common.
So we are prepared for when that patient comes in, how to identify, how to isolate them, and if needed, how to get them admitted to the appropriate area of the hospital.
While the technology is being used in a healthcare setting in this scenario, Scow says there's another area of Vera eCare can be especially useful when it comes to the coronavirus. In your home.
Through the direct-to-consumer platform, we can help arrange them to get admitted. So it's really the biggest piece is to limit the spread. We want to isolate patients, and we don't want, per se, the worried well that may have symptoms, but they're a 30-year-old male, they have no risk factors, they have a fever and a cough. We really want those patients at home to limit the spread.
And using technology like this to connect could do just that.
So when you think about telemedicine and telehealth, we're really uniquely positioned to be a force multiplier on these front lines on COVID-19.
And that is KELOLAND's Kelly Volk reporting. Now, Vera eCare has a wide variety of customers all across the country, including rural hospitals, prisons, and schools. For an in-depth look at how the South Dakota-based service is helping people across the U.S., you can read the report on KELOLAND.com original. We've put together a complete guide with everything you need to know about the coronavirus. You can access it online and on your phone. On our KELOLAND News app, you can tap the guide to coronavirus at the top. There you'll find several different features, including all of our local coverage and every resource you could need from the Centers for Disease Control. And if you don't have the app, don't worry. You can click on the guide under the News tab on KELOLAND.com. We will continue following all of the latest on the coronavirus coming up this week on KELOLAND News. That's all the time we have for right now. Join us every Sunday following the 10 o'clock news right here on KELOLAND TV for more on what's going on inside KELOLAND.